Howdy y'all, and welcome back to Professor Truelove's Concepts for Nurses series, and I am Professor Terry Truelove. And in this episode, part of the High Acuity Nursing series, we will look at shock, manifestations and types of shock, part 1. Sources for this episode include Iggy's Medical Surgical Nursing and Soul's Introduction to Critical Care Nursing. Shock is defined as any problem that impairs the oxygen delivery to the tissues and organs. Any of these episodes, whether it's from the heart, whether it's from not enough volume, whether it's from a chemical imbalance, can precipitate shock. It is a widespread abnormal cellular metabolism in which oxygenation and tissue perfusion needs are not met. This is a whole body response or a syndrome, which can lead to a life-threatening emergency. Shock can be classified by either what system it impairs or what system it originates from. So it can include hypovolemia, cardiogenic shock, distributive shock, and obstructive shock. We will discuss the different types of shocks in this episode and how one shock can be really classified as a couple of different types of shock. All types of shock can usually be prevented through accident avoidance or awareness or early recognition. One way to do so is to avoid trauma and hemorrhage by using proper safety equipment, things like seat belts, and being aware of hazards in the home or in the workplace. Another way to do so is to reduce exposure to pathogens. Some secondary preventions include assessing for early manifestations of shock and patient teaching on which things to avoid, lifestyle changes, and early manifestations of shock. Cardiovascular manifestations of shock vary. Initially, the body tries to compensate for the lack of perfusion. However, eventually, the body will reach an exhaustion phase. Cardiovascular manifestations, therefore, include a decreased cardiac output, increased pulse, decreasing blood pressure, narrowed pulse pressure, postural hypotension, low central venous pressures, flat neck and hand veins in dependent positions, slow capillary refill, and diminished peripheral pulses. Continuing with the compensatory response of the body, respiratory manifestations include an increased respiratory rate to try to compensate for the increasing metabolic acidosis. The body will deteriorate if there are no interventions. This could lead to shallow death of respirations. Throughout the entire process, initially there will be a decreased PaCO2 and a decreased PaO2. This will not hold true as the body decompensates. One type of shock is known as hypovolemic shock. This is caused by low circulating blood volume. This causes the mean arterial pressure, or MAP, to decrease, resulting in inadequate total body oxygenation. It is normally caused by things such as hemorrhage, external or internal hemorrhaging, and dehydration. In cardiogenic shock, the problem is with the heart itself. The actual heart muscle is unhealthy and therefore pumping is directly impaired. Myocardial infarction is the most common cause. However, other causes include cardiac infections and untreated valvular diseases and abnormalities. In distributive shock, the blood volume is sent or distributed to interstitial tissues where it cannot circulate or deliver oxygen. This is caused by either a loss of sympathetic tone and or blood vessel dilation, pooling of blood in venous and capillary beds, and capillary leak. Types of distributive shock include neural-induced distributive shock and chemical-induced distributive shock. Two types of neural-induced distributive shock include traumatic brain injury and spinal cord injury. In both cases, this will change how the vasculature handles extra fluid. In both traumatic brain injury and spinal cord injury, the body may lose the ability to control the arterioles, and therefore that will cause a dilation of those blood vessels, leading to a lowered blood pressure and hypoperfusion. With obstructive shock, the heart is impaired and is no longer able to pump effectively. And this is because of conditions outside the heart prevent either adequate filling of the heart or adequate contraction of the healthy heart muscle. Pericarditis is the most common cause, but another reason for obstructive shock is something called cardiac tamponade. That does conclude this episode. However, stay tuned. There are more episodes to come. In the meantime, I hope you learned a little bit. I hope you plan on coming back and listening some more. And if you are, we'll see you then. Take care.